Welcome! As you saw on the screen, the current topic will be trophoblastic disease, and this presentation has two sections, medical and legal. The trophoblastic disease is a range of gestational and non-gestational disorders presenting a vast group of neoplasms of the residual placental tissue as well as of the ovary in women and sperm in men. It is one of the rare metastatic malignant tumors that is curable. Even the patients with multiple organ involvements, such as metastases in the brain, lungs, spine or vertebrae, liver, spleen, omentum, and kidneys, are potentially curable if managed properly and optimally. One of my relevant books, published in 2013, has more detailed descriptions of the differential diagnostics, staging, prognosis, and management of this disease. The legal section presents 5 published court opinions on misdiagnosis and mismanagement of trophoblastic disease. Both medical and legal sections end with review questions and answers, 5 for each section. You will also read in my disclaimer on slide 62 that I present knowledge cultivated by my own experience as an OBGYN doctor, as well as based on 116 published sources, of which 105 are listed in my book. Understandably, I could not credit all sources in the limited slide space, so I only cited some. Now, the classification of this disease is rather a subject of confusion among patients and healthcare providers. Clinically, trophoblastic disease has 2 main types and multiple subtypes. The first type is totipotent germ cell tumor that can affect ovaries in women and testes in men. The female totipotent germ cell tumor is a non-gestational trophoblastic disease that occurs in teenage girls or young women and most often affects just one ovary. It has 2 subtypes, pure choriocarcinoma, dysgerminoma, and the other subgroup includes mixed choriocarcinoma and yolk sac tumor that is rare. It affects little girls and is very malignant. The second major type presents the gestational trophoblastic disease, which itself has benign and malignant subtypes. Of the benign subtype is the hydatidiform mole, which itself can be partial and complete. The malignant subtypes include persistent hydatidiform mole, invasive mole or chorioadenoma destruens, placental site trophoblastic disease or PSTT, choriocarcinoma, and epithelioid trophoblastic tumor or ETT, or otherwise known as atypical choriocarcinoma. Next is the histopathological classification of trophoblastic disease. From this point, I will let you read my slides on your own. Over the course, you can pause to read the slide at your chosen slower pace or mute the music if you don't like Bach's preludes or inventions, which is hard to imagine. I wish you well.